Good morning to you all. First, I thank Jaffna Medical Association and Wellbeing Center, Faculty of Medicine, University of Jaffna, invited me to this workshop. Here you have two wonderful lectures. Now you want to stay Sri Lanka, you go free to province. Next, you can choose your career pathway. So, if you stay Sri Lanka, you won't know our Sri Lankan career pathway. I won't elaborate briefly about medicine and subspecialty. Because I have been on medicine for last 15 years after internship, so I know a little bit of medicine. So I will share my experience with you. So before that, what is medicine? Medicine is health and healing. It includes various specialties, doctors and nurses. It covers diagnosis, treatment, and prevention of the diseases. Also researchers. Already Dr. Prof. Rajendra told you regarding to how to do now you are the budding doctor. It's a good opportunity to you all to get some idea. When we were medical students, we didn't have this much of progress. Now you have, after the MBBS, your lecturers start to prepare your next level because you have achieved one great milestone. That's very good. But you will pass next milestone as well in the current world. Otherwise, you feel inferior to others. Okay. So, it's as usual, already Prof told what are things you need to do as a doctor and do the future career. So, in medicine, we have two main paths. One is a diploma. We have two diploma, chest and pediatric. So this is mainly anyone can do for their great promotion, as already told, or in work in the specialty field. Other thing is that we have two broad arms, MD Geriatric and MD General Medicine. So consider the MD General Medicine. So usually we have two exams annually. And the course duration is 2.5 years. Also, after the Part 2 exam, you can choose your specialty or general medicine. So, how can you enroll in the medicine Part 1 exam? So, you must have SLMC registration. Also, you have completed your internship and post-internship 1 year period. In addition, you have 6 months of intern in medicine, or after the intern, you have 6 months first on call in medical field. Also, you have to complete advanced life support course. So, selection exam. When I was in Part 1 register, we have two papers. One is medicine and OSCEs. We don't have any basic science. Now everything are changing. So now you need to do basic science and general theory paper. You score each paper more than 50. Then only you can go to OSCE. You have 12 OSCE stations. We consider the course after you pass the Part 1 exam, you called as a medical register. You have to do the training in a general wards in 1.5 years. Here, you are posted in tertiary care hospital, teaching hospitals, because internship, you don't get in teaching hospital. You are working in the base hospital. You don't have adequate cases scenario. So here you can see different presentation of same illness or same presentation of different illness. You can acquire a lot of skills, knowledge. You can discuss with various specialties to your patient. You can get more knowledge here. After the 1.5 years general medicine course, you can go to the rotation subspecialty. Each has 4 weeks, except cardiology and neurology, which are each 8 weeks duration. So after you pass MD, you finish your MD training period, you can sit for MD Part 2 exam. Here, you can select, you can choose your future career. Then you can get some knowledge. You can see various subspecialties and general wards. Then you can some idea to choose your future. So a lot of things are depend on that. Already discussed regarding. So we have a lot of specialties, subspecialties. You can choose according to your wish. You think you have your life balance. You are earning. You want more money. You want to go abroad. You can select according to the course. So why chose to be a physician? This is a old field, like our medicine also. It's a challenging. We have seen different patients. Sometimes we don't have diagnosis. It's a mystery. So we need to discuss in case forum repeatedly or telemedicine. We discuss the patients and get to know some idea to read the patient. So it's not simple. Sometimes it's not simple. It's take a time it's challenging to diagnose the patient. So you can read a lot of things to treat your patient and manage your patients. So I have been in the medicine for last 15 years, but I am never boring regarding my field because we are seeing the new patients and we are reading and we are developing our knowledge further and further. So you have enough. Your last 5 years you are studying, but you want studying further for your development of your skills. So I come to what are the advantages of doing medicine? So one thing, so consultants, vacancies still exist in the ministry. After this economic crisis, there are some more vacancies. So many doctors are moving abroad. So you have get a permanent job. You don't worry about losing any job. So you can get a job here. Second thing, you have to choose several subspecialties. If you don't choose dental medicine, you can have enough subspecialties, fine specialties. You can choose it. Also, you can register UK without flap. You pass the NT, then you can go through the GMC registration without any sponsors. Because in my period, we need to ask if sponsors or PGM are sponsoring to do the GMC. Nowadays, you don't need to do any sponsors. So, and you can get a good earning capacity after your duty hours. If you want money, you can go to the private sector. You can earn money. We have plenty of hospitals available here and there, so you can earn a lot of money. And although one thing, the study says physician lifespan is more than the surgeon's lifespan. So that's also you can after retirement also you can enjoy your life with your money. Sorry, I forgot.
Good quality life.
So you have to go to the overseas. After part 2 examination, you have to do 1 year, local training in Sri Lanka or also overseas training. According to the field, for example, general medicine, you need to do 1 year local training here in Sri Lanka, then you must do 1 year overseas training. It's different for every field. In cardiology, you must do 3 years local training here and you must do 1 year overseas training. But our government allows us to stay 2 years because we can earn money. Because we can earn money in Sri Lanka compared to the developed countries' income. So we can get plenty of job opportunity. They are willing to give jobs to us. You don't need to go to the PGM pathway. We can apply yourselves. We can get a job these days because they are like Sri Lankan graduates. Because of dedicated service-minded people. Meaning another thing is the monthly pay. How much are we getting from our health ministry? Less than 1,000 sterling pound here in Sri Lanka. But you can get more money in UK. But you may to pay tax as well. Okay. Then we know the advantages, and I must tell the drawbacks as well. So we must do the hard work. It's obvious because after we finish, after return to back to country, we certify board certified as a consultant. So ministry posted everywhere in the country. If fine specialty, they can get the job in district general hospital. Each capital we have the district general hospital, but as a physician, they put on the base hospitals. So we must sometimes be allowed to work that hospital. So we must work Monday to Friday at least. So we have every day on calls. We are calling every day, 24 hours. There are uni doctors calling us to get the advice. So we should answer their questions and answers. So that's one thing. I think family life also may be affected. After my local training, I was posted in Nindavur. I didn't apply also, but far away from 350 kilometers far away from my home country. The God closed one eye at that time while open other eyes. So then in Nindavur, I met my deputy health minister, who is from that area. So he helped us. He helped to me. So sometimes you can get benefit also. So that's other drawback. Sometimes in our countries less we can get the medical legal problem. In abroad we can get the more problems. So that's other drawbacks too. If you want rich, famous, a happy life, why you can't select medicine? This is your thinking. So thank you very much.